So welcome Carrington College students. We're really excited to have you on. We have 3 Carrington College alum who are excited to share with you their experiences as dental hygienists and at Aspen Dental. This isn't Ask Me Anything, so I'll go through a few housekeeping things. Feel free to ask questions in the Q&A box. I'll get them out to our 3 lovely alum, and we'll hopefully get all your questions answered for you. If there's a question that doesn't get answered, or if you think of one late at night, email me. We'll make sure we get you an answer. So I'm Emily Miller-Lair. I am a hygienist for Aspen Dental, and I am the academic and industry relations manager for dental hygiene. And I'd like to really spend some time and introduce you to our 3 guests. So guys, if you could share your name, share how long you've been with Aspen, how long you've been a dental hygienist, and when you graduated Carrington College with the students, we can go ahead and get started. So I'll go ahead and start with you, Charlotte. Can you share a little bit about yourself? Oh, I think she froze on us.
Yes. So for those that didn't join a little bit earlier, oh no, I'm moving. I'm not frozen. Am I good?
You're good. You're good. You're great.
Oh no. Okay. Sorry. I'm living in an RV now because I've decided to travel. So you'll have to pardon everything. But so I grew up and I'm from Phoenix. Most recently came from Surprise. I've been with Aspen for, almost 7.5 years. I started clinically in Lufkin, Texas, a very small office in East Texas. And I honestly fell in love with the patient. So I stayed around and did a 2-hour commute one way just because I love the patients so very much. Moved into hygiene management, hygiene director, and then took a step to the quote unquote dark side and went onto the operations team. And I did that for 2 years. And then decided to settle down. My youngest left the nest, so it's just me. So hence the traveling and wanting to take a different approach to helping hygienists, and that was through recruiting. Kind of understanding the first few steps and kind of who we are as culture in a company. That's really important to me. So I think it kind of fits. So that's me.
And you are a Mesa graduate, right? Or Mesa?
Yeah.
Very cool. Well, we'll talk about work-life balance. I didn't know you were in an RV. How fun. All right. You want to share a little bit about yourself and your career and where your alumni at?
Did you say me?
Yes.
Oh, you cut out. Sorry.
Oh, I'm sorry.
No, not a big deal. Either that or I'm not listening. I am Jessie. I go by Jessie, but Jessica Salas-Pratt. I graduated from Carrington College in Boise. What? In 2015. I love Southern Idaho. I love Boise. It's always a part of my heart. But my husband is from Northern Idaho, so that's where we ended up. I started with Aspen Dental. I opened the office in Lewiston, Idaho in 2017. And I started with the company, honestly, as kind of a stop-off point. I was going to apply for dental school. I was kind of burned out on being a hygienist because I worked at a Profi mill, basically. And I came here and it reignited my passion and drive for hygiene, just because of the respect, the autonomy, and how much encouragement I got and support I got and respect I got. So that drove me to want to strive for management. And so the first steps I took was mentor and trainer. And then after that, I very quickly stepped into the territory hygiene manager role after my 2nd year with the company. So yeah, and here I am.
We're lucky to have you. Thanks for being on today. And then Monique, you are the newest member on this forum of the Aspen team, and probably a lot of people in the Mesa School recognize you, but could you please introduce yourself and tell us a little bit about yourself?
All righty. Good evening, everyone. My name is Monique Russell. As Emily mentioned, I am a super new grad. I graduated from the Carrington Mesa campus in May of this year. So I've only been a hygienist since August. Also started with Aspen in August. Before I even got my license, I started just shadowing and things like that. So very new into the organization and very new into the profession, but super excited with all that I've done so far and being part of this family.
Oh, that's awesome. We're so lucky to have you. I was lucky enough to be part of your interviewing process. And we always tell the joke that this is the first time I got to see her face because she got hired. And what a beautiful face and smile, because she got hired during COVID. So she was wearing a mask the whole time. So I got to see like a split second when she switched into a level 3 to be on the clinical side. But this is the first time we've actually gotten to see each other. So thanks to you. Well, we have got a lot of questions already coming in. So excuse me if you see me looking to the side. I am literally just looking at our questions, but the students are really fired up. So I'm going to go ahead and ask some of their questions for them. So great one right away. And I know we're all in different markets, so it may be a little different, but what can you expect, or how does the compensation work at Aspen Dental? Let's start with you, Jessie.
All right. So I can say that Aspen's very competitive as far as an hourly wage with Hygienist. We don't work off salary or anything like that. It is an hourly wage. And we also have the opportunity to make incentives. So with that, we don't compromise on our hourly wage either, because that's usually a really big question I get in interviews is, okay, well, you're going to give me an incentive, but how much are you taking off my hourly wage? We don't do that. It's actually based on some of your performance goals and how great care you're giving to your patients. So if you're doing all the right things, right, we're giving the best care possible to our patients, you're probably going to incentivize. And how the incentive structure works, you're running it like a business. So you have a lot of ownership. So if you're driven and you really want to go places, you can really go places. And we have a lot of hygienists that do so well with that.
Yes.
They just take that baton and run. So that's why I love it. I'm competitive.
Very, very cool. Anybody have anything to add on what to expect compensation wise?
I would just mirror what Jessie said. I feel like as long as you're taking care of your patients and doing right by your patients, everything falls in line, honestly. So as far as doing like diagnosing correctly and things like that nature, it just falls in line and you'll make those incentives and you'll be able to see that in your paycheck.
What I love about it too is that everything that you've learned in Carrington, and I can say this seeing so many different candidates from all over the United States, but and they're all brilliant in their own way. But I will say this, I was fully prepared coming out of Carrington with recommending treatment plans, understanding what maybe adjuncts they might need, Arrestin or Atrodox, or do we put fluoride? They educated me and made me feel confident in my abilities to recommend treatment with the docs and with the patients and have those educational moments. So the incentive will come because you're already trained very well on what the right thing is to do for the patient. So there shouldn't be that fear of how does quote unquote Aspen do it differently. We do it by the book and we do what's recommended by the patient. So you guys are getting firsthand great experience at that coming from the school. I can say I was very well prepared for that.
I agree.
Yeah, I would say that we've seen a lot of Carrington graduates, and to mirror what you're saying, absolutely they're prepared. And that kind of leads, and you guys have sort of said it. You know, Jessie, you said you were at a pro female before. You talked about how you do right. A question we often get is how are you asked to diagnose, or how do you diagnose in the chair?
AAP guidelines.
Yeah.
Straightforward.
Very.
I mean, you're always going to have a situation maybe where you and doc, you know, you're going to have the situation where maybe you guys aren't on the same plane. Maybe it's a borderline patient. But what I can say is I worked with super easy docs to get along with and not super easy docs to get along with, but we always found a common ground because we just worked through it by just simply talking about it. It wasn't like my word of the highway, you have to diagnose SRP everybody. It was, okay, well, let's look at these clinical findings and, use scientific method basically, to figure out what the patient needs. And so long and the short, AAP guidelines we go by it.
Very true.
And on top of that, I would say, don't be intimidated to have that conversation with your doc, because they're very open-minded, and you have to think they took maybe a semester or two on dental hygiene practices. So they're going to lean on you to have that educational conversation with them. And it's so easy to just say, doc, what do you need to see in order to feel good about, me recommending this treatment versus this? And then talking through it, because as soon as you say, from my hygiene school experience or from the AAP guidelines, this is what's recommended, they go, okay, whatever you say, most of the time. So feel comfort in that too.
And
It's true.
So you're a new graduate, but how did you feel you were accepted by your doctors when you started practices? Because you started out floating, so you saw a lot of different doctors every week. How did you manage that, and what worked for you?
So communication is definitely number one. Being able to communicate with your doctor, being able to verbalize any maybe anything that you're unsure about, so you have that support from your doctor, I feel like has been key for me. So 100% communication. And secondly, just the support within Aspen overall, I think that has really helped me as well. There's been times when I've had a borderline case and I wasn't 100% sure. So I did ask the doctor, and the doctor agreed with what I thought. So it was just nice to be able to open up to the doctor and say, hey, I'm kind of unsure about this. What are your thoughts? And then them also being on your side for those things. So
I agree there, Monique. It's an environment, or at least in my experience, and it's an environment where it's very open. I haven't really experienced my personal experience. I haven't experienced that my way or the highway with anyone. It's kind of an open environment where we talk about what are the guidelines? Why are we coming up with this answer? So I think in that way it's really nice to be a new grad, because I don't think it's as intimidating a story as that you may have heard. That's my personal opinion. But
You got to remember too, our docs come in with some, they have training on how they're supposed to be, not to say using, but partnering with the hygienists and how to lean on them. Because we're very hygiene driven company. So hygiene is we get a lot of support. And when I say support, it's not just from hygiene managers, I mean from doctors, owner doctors, that, from day one, they're told, okay, well, this is how this goes. You're going to have to partner with her. It's a partnership. It's not like he's like, hey, do it, so they do have that kind of lead in to their office too.
very cool. Letting hygienists be hygienists. I love it. So I'm looking, it looks like our next questions are the benefits to working for, it says corporate, but we do call, we're a little different than corporate. We're a dental service organization, or a DSO. So they want to know basically the benefits and why you chose a dental service organization or corporate dentistry.
I'm going to go with, piggybacking off what Jesse started with, and it was being seen as a provider. That was really important to me. I'd seen private practice and other DSOs, and they all have, something that is valuable and important for them and their mission that I resonated with. But when I came to Aspen, it was all the picture for me made sense and kind of clicked. And having that voice, having the support teams in place, because in that moment, say you don't feel comfortable because you're a newer grad, having that conversation with the doc. It's like, hey, Jesse, can you help me with this conversation? And I'm not standing there alone and helping me through that. So there's literally layers of support for every position that we have. And that made me feel like I wasn't alone, or I always had somebody in my corner no matter what. cheering me on one way or the other. So emails, text messages, remembering my birthday, but I wasn't just an employee, I was family.
I love that. So true. Monique, any benefits for you that really stood out?
100% the support. I've done a couple working interviews before committing to Aspen, and I just didn't feel the support that was there, or it kind of felt like I was floating on my own and I didn't know what I was doing. So having that support with Aspen and being encouraged and uplifted and things like that really helped me and made me feel like I was at home and that I could ask questions. And I know that I'm a professional now, but I also can ask questions and learn and continue to learn day by day. So I appreciated that.
That's really awesome. How about for you, Jesse? Any benefits that stood out?
I wish I had found an Aspen when I graduated hygiene school.
Amen.
I think it would have probably changed the trajectory of my career for sure. You know, when I got here, I didn't really know what a DSO was. I didn't know what corporate was. I just had always heard rumors that, rumors. And I was just like, they're all the same. And I got here and it really changed my mind. And so whenever I talk to new grads, I'm just like, I'm going to be honest with you. I wish I would have started with a company like this before, and it's been just a game changer, honestly, hygiene career. So.
Yeah, I'm going to pipe in on this one a little bit too, because for me, I worked private practice before, had a good experience, but what happened was I had to take vacation and things when the office took it. So my friend's getting married, I couldn't just take vacation. I am definitely a work-life balance person. So for me to have to take my vacation at a certain time, or kind of do the things that a smaller group sometimes does, I don't know if everyone does, we did, was challenging for me. So I really liked the idea of knowing, hey, if I'm gone, I know that there's going to be an Aspen dental hygienist that's going to come in and they're going to do a great job. And I probably already know them. And so for me, because you care about your patients and you care about what happens when you're not there, it's nice to know that, they're going to get the same standard of care and see somebody that if you have questions, you can talk to them again. It's not like they were just in and you never see them again. So those were things that I really enjoyed about like a DSO and how it works. So I'm going to pop over to the next question. It looks like they want to know the typical hours and if they vary. So do you want to talk about typical office hours? Monique, you're probably our best one there because you're in the office every day. So tell us what your typical week looks like. And I think when they say vary, I'm going to guess they're asking the question, like, are you asked to clock off and things like that?
Okay, so as far as typical workday, I do find that it varies from office to office. Just being a float, I've seen it in different offices. So most of the offices are between 8 to 6. You get 32 to 40 hours a week. Some of the offices, I know that I've started at 7:30 instead of 8 o'clock. So there's small variance as far as that goes. But what I was guaranteed, I feel like all the hygienists pretty much work at least 32 hours a week, up to 40 hours guaranteed. And then also, as far as clocking out, that's one thing that I really appreciate. If we don't have patients or if our schedule falls apart, we don't clock out. We do other things in the office. We confirm our patients for the next day. We do other things to take up that time and to be productive in the office at the same time. So that's one thing that I also feel like is key. Like if you're expecting 32 hours a week, you're getting those 32 hours a week. You're not clocking out because your last 4 patients didn't show.
Very cool. Very cool. Any differences with hours or anything like any differences with hours or experiences for Jesse or Charlotte?
I'll say that not everybody's full-time on my team. I have some moms, especially coming we're still in the middle of a pandemic, obviously, but we have childcare issues, right? And even when I was clinical, I had a 2-year-old, it was easy for me to I had a second hygienist at one point, so we could kind of alter the schedule. One beautiful thing about Aspen is I remember I'd have an SRP case once in a blue moon, and they'd have to wait 6 weeks to get in. And it was really frustrating for me. And so we're about access to care. And that means that sometimes we don't have just one hygienist, we have a float hygienist, like Monique was talking about, that comes in and helps cover vacations or helps cover when, so-and-so is having childcare issues. Like right now, I have all these different PRN or as needed positions just for, new grads or people who just want a couple hours to fill out their schedule because they are floats anyways. So it varies by office, like what hours they're open, but as far as like what you need to make your life work, we are pretty flexible on that as well. So,
yeah, that's really important in a time like this where people might have different needs, to be flexible like that. I would say in my experience, it was mostly full-time, but we did have other positions available. And of course, when people needed flexibility, that's something that we would definitely work with. How about you, Charlotte? Anything on hours? Oh, I think she froze for a sec. We'll get back to you. It's a good freeze though, not a bad freeze.
it is.
Our next question is, oh, and I think we kind of answered it, but we can jump on it. Are you responsible for filling your schedule with patients don't show? And you really answered that already when you said you make calls, but you're not responsible in the sense that you lose hours. So I think we've got that one. And we kind of already went over the diagnosing with a doctor. So that's another question. Do you suggest shadowing while you're waiting for your license? So I know, Monique, we hired you before you were officially licensed. Do you kind of want to go through what that process was like and what the training process was like for you?
Yeah, so when I initially came on, I didn't have a license. So what that looked like is I came in, I did get to shadow a lead hygienist. So kind of going through it day by day, seeing what her day looks like, watching her while she was doing patient care, taking care of new patients, things of that nature. And then in the same sense, I was also doing a virtual training through Aspen. So kind of going through different scenarios as far as what diagnosing looks like in office, also taking a look at Aspen as a whole. So what there is to offer, the different representatives that come in and talk to us, like Arrestin, Atrodox, Zoom whitening, things like that. So it was probably about a 2-week training period. So it gave me time to figure out the flow of each office, learn about Aspen a little bit more in detail without being thrown in and having to see patients right away. So that was kind of a nice transition and a benefit because I didn't have a license, and it felt, being a new grad, it may feel kind of intimidating just going and seeing patients right away. So that gave you kind of like a way to put your foot in the water without jumping all the way in.
Very true. A supported start rather than a jumping
Yeah.
in. I know I always joke that when I first started, because unfortunately, I didn't start with Aspen. When I first started, I felt like I was pretending to be a dental hygienist. I was a dental hygienist, but it felt like I was pretending because it was all so new. So it's nice that we do that 2 weeks to help you out. Jesse and Charlotte, kind of to that vein, what are some other trainings that are available through Aspen for dental hygienists?
As far as like on some of our
Like
like initiatives or
Yeah, like our CEs and some of the events that we have in non-COVID times.
yes, we have fabulous things happening. I miss these events. I was in the middle of planning one, so I'm a little bitter about this. For March, for a territory-wide meeting where we have live CE, we feed you, we, have fun and games, but we also have like serious meeting time. But it's so cool to come and like meet everybody in your territory. My territory has, I think, 28 offices in it right now, and so all of those hygienists, floats, the full-time hygienists all come together and they get to meet, talk about stuff, learn something, eat together. I just think it's a great experience. And then we also have trainings that are away from the office that are really fun to go to too. So lots of CE. I've never paid for a CE credit since I've been here.
Yeah,
That's just pretty cool.
it is very awesome. And we actually have our, not our live CE, some of our live CEs, but we actually have our CEs open for anyone. It's like a ridiculous amount, like 2,000 credits of CE. So if anybody wants to check it out, you can go to aspendentaljobs.com, and there's 3 little boxes. The one to the left is our CE, and anybody can use that. So something to remember.
Many of our hygiene directors are also certified for CE presentation.
Yes. And they do some
they are
great ones. I
working-
just watched one on AAP that was really exciting. And there's a new one coming up about vaping. So that'll be a fun one too. That's kind of a hot topic. Charlotte, what about you? What kind of trainings have you done or do you enjoy through Aspen?
Oh man, where do you begin? I'm sure once we get back to our regular swing of things, you all will enjoy our hygiene orientation program where you get people from all over the United States together and kind of pick each other's brains. I have lifelong friends that I still communicate with. And it's funny because now one of them's recruiter. So it's just, the family just grows. It's so funny. But it's, we got hygiene orientation program. We've got the online CE. We've got the in-office CEs. We've got reps coming in, as Monique had mentioned. We're always doing something together. And, even crawfish boil, we got together and did like a hygiene night out, and we did a crawfish bowl together. And then let's see, I don't know, like my hygiene manager and my support team, we were always thinking of something that we could do together, but also get some education and fun out of. So, I mean, you name it, and we could probably think of a way to do it.
I know we've got a yoga CE coming up soon that everybody's pretty pumped about.
Yes. Yeah, we're doing
excited.
yoga. One of the recruiters is actually doing the yoga, and then I think I'm doing one of the guided meditation nights, and I do the well-minded hygienist. So things you can do in your app to set the tone and the right energies and stuff for your day. So
Love it.
Oh,
Absolutely.
I love it. I didn't realize that was
That's so cool.
exciting. Definitely one to take advantage of. Just taking a peek. It looks like we're getting questions about like our COVID response and what type of protocols we have in place since COVID. Monique, I know you're in the office every day, so can you I was going to say they're not different for you. They've been the same since day one, but can you talk about some of the protocols that you see that we've been having?
Yeah, so one thing that I really appreciate is the protocols that are in place at Aspen are the same protocols that were in clinic when I was exiting out of school. So we're wearing gowns. We have dry shields when we're doing SRPs. We're only using our like cavitrons and ultrasonic scalers when there are SRPs. So we're really just sticking to hand scaling and not producing additional aerosols when not needed. So pretty much the things that you're doing in school carry out into Aspen world as well. So
Yeah.
we're using N95s, masks, shields, gowns, everything. So I feel like it was a smooth transition from what we were doing in school to what Aspen's doing.
That's awesome. I love hearing that. Sounds like a great program. And that's one of the reasons we really love Carrington is we always get students that transition really well because they've learned the right way to do things and we do things the right way also. So really nice, smooth transition. I was always told it's really different when you get out of school. And it's nice to be at Aspen where it's not really different. You're really following the same protocols that guide your practice, you know, so. Very, very cool. And Jesse, I know you saw a little before and after. Is there anything else you can think of that's different since COVID that we've added?
So we've done obviously like temperature checks for all the employees and logging, that kind of stuff, which, you know, you're like, oh, I gotta do this every single day, you know, do the little thermometer gun. We're also doing the same thing for our patients as they come in, so we can track that. And you know, we're following those universal precautions to a T, making sure that things are you know, done properly. And the great part is we all have a great level of accountability in every office, so people aren't afraid to like help coach each other in the moment, which is cool. What I found, they're like, hey Brenda, you forgot to do this, like next time just know, you know. And so it's kind of cool to have every working together making this work, because it is different, it's new, but it's working and we're making it work. And I'm really happy to hear that like we have the access to all the PPE that we do. I will say I have some friends that work in private practice and they're like, you have that? And I'm like, yes. And EverEdge instruments, you know, like, you know, because we're doing more hand scaling. Like our hygiene team stepped it up. They're like, here's perio kits, here's Profi kits, they're EverEdge instruments, here's how to use them, here's how to sharpen and a CE on it. I was like, oh my gosh, like when I'm talking to people about this, they're like, you have all this stuff. I'm like, yeah, it's amazing. Like, I can't believe it myself. It's pretty cool.
Yeah, it was really awesome to see how having these different departments, like we have a health and safety department, we have a procurement group, really enabled us to be ready when the states allowed us to be open again and to really serve our patients. And I think, I know I was surprised and maybe some students would find it surprising too. We were actually very busy and still are very busy during this time. There's a lot of patients in need and pain that, you know, have high infections that need us, and we're still very, very busy. And we were able to jump right back in and do it safely. And I'm really proud of that with Aspen. I think that when the going gets tough, you know, the tough get going, and it was really neat to see that happen and to see it work really well and to be kind of seamless on, you know, at the time I was managing a group of hygienists, and it was really nice to have, you know, like Charlotte was talking about, those layers of support. So, you know, the hard stuff was covered and you just have to help people implement it. Kind of a cool thing too. Most people feel comfortable in teaching in the moment and talking to each other if things aren't being followed or protocols aren't being followed, but Aspen does many layers. So if somebody didn't feel comfortable, there's even an 800 number. So you could, you know, report it if you don't think you're safe. Like, safety is very important to us. So, we've got
one last thing, if I could add.
Oh yeah,
sorry.
absolutely.
I think what's really cool too is we asked if they needed more time because of the procedures that we had to follow. So it wasn't like, hey, do everything that you've been doing and do it in this much time while wearing all of that and then try to figure out when to change it and then do that. They were like, hey, we know that you're human and we know that there's extra steps. So what's a lot of that extra time on either end of your appointment to make sure that you still feel like A, you're being safe, B, you're not driving yourself mad and crazy trying to do all these in-between things, but C, so that you feel good about what you're doing every day. Oh. So it was just the way that they did that piece, that melted my heart, because I think it's something that gets overlooked potentially in other places, because I hear it as I'm phone screening these candidates that are interested in the positions, like, what are you guys doing with the times for COVID? I'm like, what do you mean? We're like, we're adding time. They're like, really? So I know that it's out there, that they're expecting the same at other places. I don't know where they are, and it's really doesn't matter. But the point is, like, it's huge. All you have to do is say, I don't feel good about, or I need more of, and and then I'll feel good about what I'm doing. And they go, okay, let's put that in your, you know, let's adjust the schedule. It's not a big deal. So there's no pressure there.
Yeah, that is a great point. And it kind of goes to the next question, not just with COVID, but how much time or how are we allotted our times for the schedule? So Jesse, you can start there. How are Aspen Dental hygienists scheduled for different procedures?
This is my number one question I get when somebody interviews for a position. This is like the first thing they ask. It's funny, especially for new grads. So as a new grad, I remember interviewing for positions and I was terrified because it took me 4 days to finish an SRP, because we had them for,
True
forever.
story.
Remember that? And I'm like, how am I ever going to get this whole thing done? Anyways, as I gained experience, I'm like, heck yeah, I can do it and whatever. But then these new grads started asking me this and I'm like, well, we just adjust. I was like, it's not even a question. Because when I was training hygienists, I'd get a lot of new graduates. And I'm like, they're like, how are you doing this? Like, am I going to be able to do this? Do I have to do that? And I'm like, no. You have to adjust your time. You have a lot of autonomy there. It's always within reason though, so when we're looking at, as the hygiene manager, as I'm looking through schedule, maybe I see something that like an adult prophy and it's 2 hours. I'm like, I'm going to ask a couple follow-up questions. I'm not going to come knock at your door, but I'm going to say, hey, what's going on here? Can you just let me know? And they're like, hey, this patient is, special needs. I have to get them in and out of a wheelchair. I'm like, all right. That's great. I just ask the questions first. So nobody comes, knocks your door down. We just want to know, kind of like what the thought process was, or, oh, did you not agree with doc on the, it could be something like that where we need to come in and help coach, or it really could be a reason that they need extra time. We give you a lot of autonomy with that.
Very awesome. Monique, as a new grad, what do you see on average for times, or how are you able to adjust times if need be?
So one thing that I really appreciate is communicating with the office manager. So even at the office that I'm at today, the office manager was asking me, okay, so how much time do you need for an SRP? How much time for perio maintenance? So also having that communication was really, I really appreciated that. But on average, what we see is like perio maintenance is usually an hour, prophies typically about an hour. And then also the same thing with scaling and root planing with half mouth, about an hour, depending on if you're placing a rest in our atrodox. There may be additional time allotted for that as well. But typically I've seen like hour appointments, and then where needed, the time is adjusted. So I feel like there's, like everyone mentioned, a lot of autonomy over your time frame and your scheduling, as long as you're as long as you're communicating with your office, communicating with the doctor, the office manager, and things of that nature.
Very good. Anything to add about scheduling, Charlotte? I know you spent a lot of time helping hygienists schedule, but you had really good points about. I mean, that was huge, adding that during the getting used to PPE.
Yeah, for sure. And I think, the reality is we all function at different paces, and we don't know what's in each patient's mouth. So no one in that office does but you, and, maybe the doc because he was in there. But at the end of the day, it's, again, what's going to make you feel good about doing the right thing and the right care for the patient. Obviously, like Jesse said, within reason. If it's 4 hours for one quad, someone might go, what's happening with the patient, and what's going on there? Do you need anything from the team or anybody like that? But for the most part, it's on you. Like it's really running a business within a business, and what makes you feel good about taking care of the patients every day. And no one can predict what walks in the door. So there has to allow that flexibility in all practices, right? Like we have to be able to look and say, this patient has different needs or different medical things going on, or maybe they have a higher anxiety rate than others. No one can understand that better than you can. So it's just communicating that with the office. But then once you kind of have a system in place that works for you, that you feel good about, literally you'll go into any office and it's like posted on their computer. Nobody, or at least near it, so they all know, like, hey, this is Monique's preferences, so don't schedule outside her preferences. Like, Monique wants these things, and then they do those things, right? So it's like in every office they have their parameters up on the screen, and they listen to those. So unless you give them something specific that says this patient's a one-off, and I need less time or more time, they're going to follow that to the core.
I love that. Lots of autonomy in your schedule, lots of autonomy in what you do. Kind of back to what Monique said earlier, you do right by the patients and everything else follows. So really doing that schedule in a way that it's right for the patients and your abilities. So I love that. So it looks like we have a question that says, it's kind of back to the pay. They want to know, they said it may have already been covered, but do we get paid by the patient or by the hour? So if we can just jump through that real quick. I think we answered a little earlier. We get paid by the hour and then an incentive on top of that. And really the incentive is, we talked about it, really achievable if you do right by the patients. So wanted to get that for her because she asked, what type of patients do you see at Aspen Dental? That's a really good question to ask. So tell me, Monique, like what type of patients do you see at Aspen, the typical Aspen Dental patient?
Definitely, I would say that the typical Aspen Dental patient is someone who probably spent most of their time taking care of others and kind of neglecting themselves. So they usually come in and they're now they're taking care of themselves. Now they're making their oral health a priority, making their overall health a priority. So that's number one with the type of patients that we see, I feel like. And then as far as like treatment wise, we have a variety of patients from on a day, I see scaling, root planing, prophy, perio maintenance. So it's never just one type of treatment that I'm doing. It's a variety, everything. So I think overall, what Aspen says, we see the blue collar worker, that type of patient who's now taking care of their oral health, making their self a priority. And our job is to help bring their care to something where they're able to, one, maintain at home, and that we relieve them of any infection, disease that's going on in their mouth, and just give them that foundation where it's something that they can maintain, be proud of, and take pride in.
Love it. Love it. Very true. I know, Charlotte, you probably get a lot of hygienists that have questions about that. What do you think the average Aspen Dental patient is like, or your experience with the average Aspen Dental patient?
Yeah, so blue collar, hardworking, typically non-compliant. So it's taken them 10 plus years to walk in the door for the first time, if they've ever even thought about it, right? So they're typically the patient that's like, I either had a bad experience as a child, and that's where I'm kind of lingering, and they're, really nervous coming into that first appointment. A lot of them are really embarrassed because they know it's taken them 10 plus years or their whole life to walk in the door for the first time. So you will see a lot of patients that are needing scaling and root planing because of that. But you do get a wide variety of patients. Some of them are, starting to become more familiar with where we are as we're growing and getting more offices around. But if you've ever wondered to yourself, why in the heck would Aspen put an office over there? That's why. So we're there to help the patients that normally don't have access to the care that they really need. So we put offices in places that may be a little on the outskirt of the big town, or, maybe in an area that isn't new and upcoming, because those folks have offices on every corner, right? So we're going to places where patients need care and they don't always have the access to it. But then we're going to help break it down financially for them so they can actually get started, right? So knowing that they haven't walked in the door in so long, that's a big scare point for most patients is, I know I need it, but heck, where do I start and how much is this going to cost? So we have so many ways to help them in so many ways, financially, emotionally. We have sedation for oral surgery patients. We have all these extra things that can kind of come in and say, we're going to take care of you. And so it really puts the patients at ease. And that's why when I said at the beginning, like I fell in love with the patients, that really is where it's at. Coming from other DSOs where you know, it's the same patients every 6 months, which I love. I love getting to remember Sally every 6 months, and I know everything about her kids and her dogs. We have that too. But you also get the new patients that leave smiling, that came in crying for a totally different reason, and it just will change your whole life.
It's very, very true. I feel like we have a very grateful, very appreciative, anxious, a lot of times patient. And I always say like the biggest win is when the patient comes in smiling like this and leaves with their hand away from their mouth, and they're happy with their smile again. And you think about that, that affects everything. That's, you know, their moments with their grandkids, their pictures at weddings, you know, when they're not willing to smile with those teeth, it really affects them, not to mention, you know, function and everything else. Jesse, I know you've had a lot of great patient stories. Can you share with us one of those patient stories that you're most proud of?
Yes. The first one that comes to mind, it's not even with a hygiene patient. It's actually with a denture patient that I went in, and because at Carrington we started an oral cancer walk. I just got really into it. I love pathology. I'm a biology nerd. That's my first love. But anyways, pathology is great. And so I was like, I do oral cancer screenings on everybody, even denture patients. I walk in, I love chatting up the little old men, you know, ask them how their farming's going, you know, just random stuff. But this woman came in and she wanted dentures, and I offered her an oral cancer screening. And I was just like, you know, this is something we do for all of our patients, because, you know, I went through all the steps with her, and she instantly began crying. And I was like, what did I just do? Like, I struck a vein. I don't know. Like, I like kind of was like, ugh. She looked at me and she goes, my son was diagnosed with oral cancer. And she's like, and his office he had been going to since he was a child, never screened him for oral cancer. And he's now missing, like, he's notably half his face. Long story short, Idaho is a very small state. There's not very many people here. And her son was actually one of our keynote speakers at Carrington. And he came and talked to our class. He brought us oral cancer screening devices. He helped us get this run organized. And his mother walked into my office and received an oral cancer screening from me, and will always be coming to Aspen Dental. And there were tears of joy. And she's like, if somebody had done that for my son so many years back, it would have been life-changing. So whew, that's my best story I got.
You're gonna make me cry. It's so true. You think of you don't always think of the major changes you're making in people's lives, and that's huge. And I'm glad that she recognized the importance of it. I'm sad to hear that that's the why, but I'm sure it kept that reinvigorated in you. And it's nice that we have all the tools available for you to do your oral cancer screenings. Very, very good. And speaking of I guess, oral cancer screenings and technology, what types of technologies do the offices have? I know the students are probably using some right now, but Charlotte, what type of technologies do you like best out of in the Aspen Dental practices?
So I've seen 3 different types, but I'm seeing oral ID on the rise. So some will still use Velscope, some still, like, I don't think very many have Visalite, but it's there in some of the newer offices. It kind of comes with the practice when we open. And then, you know, we have iTero, so we're also getting the intraoral scan. So you can kind of compare 2 different images there too, not just for ortho or cosmetic reasons, but you can actually see mouth structure. And so if there's changes in that abnormalities, if the patients decide not to move forward with the oral cancer screening, or with the oral cancer screening itself, we can still track abnormalities that way. Some still are using now there's like a cell phone attachment to that on the Velscope as well. So the patient can actually see it and take it home when they go, I had, you know, this going. So there's so many different pieces of technology, but I think Jesse might be able to be more specific, because I do know we're more often using now the oral ID, right? But I've seen it still a bunch of different options in the offices. So
I've used all three in Aspen.
I know as the Vel scopes are getting replaced in Arizona, they're replacing it with oral ID. And then if offices have specific requests, they're giving them the oral IDs as well. Monique, when you came to Aspen, was the iTero machine new to you, or was it something that you'd experienced before?
It was very new to me. Still new, still maneuvering through it. But with anything, once you start doing it over and over, it becomes easier and it becomes more second nature. But definitely something completely new for me. But I do really appreciate using it because it gives the patient a visual when it's time to have that educational moment with them, which I've had patients say like, oh, this is so cool. Like, now I see what you're talking about, or oh, okay, I understand what you're saying now, because they get to see a visual of what their mouth looks like, the areas that may be problem areas, and best techniques on getting to it. So definitely a newer instrument, but it's definitely something that's beneficial for the patients.
That is awesome. Jesse, for students who may not know or may not be familiar with the iTero machine, what is it and what do we charge for it?
It is free, and it is a 3-dimensional scan or picture of the inside of the patient's mouth. And they get to see it on a big screen, on an iPad. However you choose to get it to your patient is how you can use it. And it's a little camera, and we just drag it along the teeth, and it builds their bite in their mouth, and it shows even all the gooey calculus and plaque and everything that's stuck on there, the red tissue, the bleeding. I love it because when I show my patients and when I'm training hygienists on this and teams, I'm always saying, how hard is it to say what you see when they can see what you say? And the patients, I don't even have to talk to them. I'm like, do you see that? And they're like, what is it? Come off? And I'm like, yes, you need help. So we get to go in, and it takes the pressure off of me, because when I started with Aspen, we didn't have this technology, and I used x-rays a lot. And I used, the mirror, and I flicked off a piece of calculus, and I'm like, and I felt like I was like really reaching sometimes, because some patients were like, this chick is over the top. But with this, I show them a picture, and that picture, like, everybody can't look at a stock image. So I want that stock image. I'm Susie, and I walked in. I'm fine, because we're dealing with patients who haven't been in. They don't know. And I'm going to be 100% honest. When I was in hygiene school, it took me a while to learn what these x-rays look like. And I'm expecting patients to know what I'm talking about right in front of them. It's hard. And so this has been probably my favorite tool in an office. And once I get teams comfortable with just whipping it out, using it, even a partial scan, just to help say, Bob, that 5mm pocket keeps showing up. Do you see that red tissue? We're getting in there today. And Bob's like, yeah, that's gross. I want to get in there today.
It is so true. The patients have some amazing reactions. And I really don't miss the old days of holding a mirror and saying, you see that back there? And
they're like, yeah,
sure, I see it. But it's really nice now because you can say, see it, and then you can zoom in and they can see it the size of their head if they want to. So it's a really fun tool to be able to have. And I think it's so cool that we offer it at no cost to the patients. Just because we know that if people have knowledge, that's power for them. And that's the power that they have to make the decisions that they want to for themselves. So really, really love that. We have an interesting question, and I think we know the answer. It says, I have no dental assisting or dental experience in general. Will it make me less competitive?
I didn't have any dental assisting or dental experience. I shadowed in the past, but I had absolutely no experience going into school. So I don't think it plays a factor as long as you're willing to learn, continue to grow, and do your best. I think that doesn't play a huge factor in any of your capabilities.
Charlotte, you've hired and you still hire a lot of people. So what do you think of that question? It says, I don't have dental assisting or dental experience in general. Is that going to make me less competitive?
Absolutely not. They are more focused on what you went to school for, and you know your stuff. You're graduating from an amazing college and you have a great degree, and they trust that in you. So it's nice to be able to, help the dental assistants, and they help you because you have a little bit of that. But I promise you that if you want to know, they'll show you. But it makes you absolutely not any less competitive than the next candidate. So you've got the degree. That's all they're looking for.
Yeah, I would definitely agree. Jesse, anything to add there? What do you look for?
I look for a teammate or a family member, right? Somebody that's going to be a good fit for the team. And so I highly recommend, if you're considering it, then shadow or come by and meet the team. Because in all honesty, private practice wasn't for me, but it might be for you. DSOs could be for you, but they could not be for you. It's, everybody sips from a different cup of tea. So you got to try it out. But when I'm talking to hygienists, I'm like, can I sit in a car with you for 2 hours and can we have a conversation, right? And I trust in the education, and you passed the same tests that I did, right? You're licensed. I'm confident in you, and we can coach and learn so much. We're all moldable. So it's a human being that we're hiring, a person, a personality.
100%. I know that's what I would always look for too. I trust that you have the education, pass the same boards as everybody else, and you're ready to go. We're hiring somebody we want the team to love and we want the patients to love. That's why we ended up with wonderful people like Monique. We really want people that love people and that care about people and have empathy. So, if you had that and you happen to have dental experience, great. But if you didn't happen to have dental experience, it's really the person that I look at when we're hiring. And I think that's what everyone else is saying here too. So super, super great. Okay, so I have another great question. What was the most important thing that you learned at Carrington that you still take with you today? Ooh, that's a tough one, right? Because you really learned everything there. What was the most important thing that you learned from Carrington that you still take with you today?
How to have fun. Swear to goodness, that is like the biggest thing. And I don't know if the same instructors are still there, Miss Mazoon, whoop, whoop. But like they taught me that you can be serious and you are intelligent, but that doesn't mean you can't have a good time with your patients and get down on their level and have them, be responsive to you. In fact, they prefer if we're that way. And who knew? So I thought I had to be so like this, you have periodontal disease and this is how we're going to treat it, and like check the blocks and make sure I said everything just the right way or I was going to fail. But in real life, patients just want you to get real with them and be transparent with them and be a human with them. They want to see that you genuinely care about the infection that's happening in their mouth, and that you genuinely care to get them in urgently because it's important to you, and you're concerned about it. And so I think that one of the things that they taught me was like, don't be so serious. Like you can have the educational conversation with them, but you also have to understand and get down on their level. And that was the game changer for me, because prior to that I was in the military where everything was black and white. So it just smoothing the edges a little bit was super helpful for me, and they did great with that. So it was awesome.
And now you're teaching mindful classes. So
what? Who knew?
what a great transition. I love it.
Right.
Monique, for you, what was the most important thing that you learned at Carrington that you are carrying with you now?
So what Charlotte said, I think is very important. Those are some of the factors as well that I learned, but I don't know why this sticks out to me so much. And I don't want to say it's the most important, but it's definitely something that stuck with me. Instructor always told us never to be like, oh, this is how you do it properly, because then that kind of turns the patient off. So I've strayed away from ever saying like, oh, this is how you, like, you're not brushing properly or you're not flossing properly, because I want the patient to feel comfortable with me. I want them to know that, one, I I have empathy. I understand, like, all right, you're trying the best that you can. So here are some ways to do it so that it's effective. So another one of our, like Charlotte mentioned, Miss Mazoon, I think she always used to say, like, don't say properly or do it correctly. Like using the word effectively helps bring that patient to where you're at, meeting them where they're at. And I think that's really important. And that's helped me a lot, just meeting the patient where they're at and being able to be relatable to them instead of like kind of talking down on them, you know?
Yeah, some great verbiage. Nobody loves the wag of the finger.
Yeah.
If you read the hygiene forums or if you read jokes about hygienists or if you see it in movies, it is about the kind of strictness that we have. So very, very good points that you guys are bringing up. What about for you, Jessie? What is the most important thing that you learned at Carrington that you carry with you today?
Whew. Well, I'm going to piggyback off of you guys too. I will say that that was one of the best things. Strong interpersonal communication skills came from my instructors. I don't know if that's just like a Carrington interview process thing, but they were strong about that relationship you build with the patient. And I loved that. The one thing I'll remember, this is shout out to Mrs. Robinson, who used to call us all princess and make us sit up straight. She'd tap us on the head or on the back and sit up straight, princess. Ergonomics is a big deal.
It is a big deal.
You know, exercise, keep yourself healthy. You know, it's rough on your body. And it, like being a mom, when I did it pregnant, oh my gosh, I was at the chiropractor. I found somebody who would work on me. But I'm like, then I kind of like rolled my eyes. I'm like, why does she keep picking on me? And now I'm like, she was right. She was real right. So take care of yourselves. It was a
She was right,
lesson.
princess.
She was right. I did like the princess part.
Too, because it's gonna stick in your head every time that your back feels
I
funny and you
know.
realize you need to sit up. You're gonna remember
I'm
that.
like, princess.
Okay, well, we're winding down here. So I'm just going to ask one more question that I really love. As far as your experience at Aspen, I want you to use one word to describe your experience with Aspen Dental. I know it's hard, one word. We're all talkers. That's tough. Let's start.
Culture.
What's your word, Charlotte?
Culture.
Culture. I love
Culture.
100%. Great culture. 100%. What do you think, Jessie? What's yours?
She's swiper, no swiping mine.
That's why I had you like shout it out. I'm like, somebody will.
It's, oh gosh, it's opportunity. It's the biggest opportunity I've ever fell backwards into. I didn't know I could grow, and I didn't know that I would love it so much. It's opportunity, and it's crazy no matter what direction you want to go. Clinical, not clinical, operational, whatever.
Yeah, it's all there. It's all there for sure. Monique, how about you? One word to describe your experience at Aspen.
For me, I don't know if this sounds cheesy, but family. I feel like I built relationships with hygienists throughout the valley, with my patients, with the doctors. So overall, it just feels like an extended family, and I feel like welcome, supported, and all that good stuff.
Oh, I love it. Love it.
Great.
You guys are so creative. Those are wonderful words. Well, I really appreciate, all the students that are on. I appreciate you guys for being on. And then if you happen to not catch this, we're going to have it on YouTube as well. So if your classmates missed something good, they'll be able to catch it. So thank you guys so much for everything that you do. And I hope to see you all soon. Bye.
We're gonna be YouTube famous.
You're YouTube famous.
Make this trend, guys. No, just so interesting.
Carrington alum trend.
Woo!
Oh, thank you guys. Have an awesome evening.
You too. Thanks.
You too.
Bye.
All right.
Bye.